Hello guys, this is Lisa, an occupational therapist specialized in Padawan therapy, master degree in autism spectrum disorder, and my main occupation are kids. And I'm sorry, last Wednesday I couldn't join you for this live session that we are having, or at least we're trying to have every Wednesday. But today it's Wednesday, here I am, so I am super happy to see you, to hear from you, etc. For those who will be connecting, disconnecting, and so on. These lives are always available online, so even if you don't manage to stay for the full session here or whatever, you can always rewatch them. Like I said before, my specialization is occupational therapy. I work with children with special needs, with different difficulties from different ages. And today I wanted to talk a little bit about oral motor skills and different tools that we use in oral motor therapy. Now, I would like to just clarify this. Let me put a little bit like that so you can see me clearly. As an occupational therapist, we work in different skills. Occupational therapy focuses not only on playtime, like sometimes it's misunderstood, or elderly, or people after injuries or accidents and so on. We work with variety of different population, basically from kids to elderly. And occupational therapy doesn't only follow on take care of, make sure that the person become independent. We focus on cognitive skills, we focus on different type of abilities that are very important in order for us to eat alone, to dress alone, to move, to feel comfortable, to have our sensory skills regulated, etc. One of the main skills that we will be working is feeding. And now I am a super fan of feeding, of oral motor therapy, of feeding therapy. And this is the reason why if you go through my YouTube channel, you will see a lot of videos posting about that. A lot. I try my best not to post as much as I can. And today I decided to continue a little bit on this topic, because there is, even though we often repeat the same questions, or we often repeat the same things, you have always different parents joining the lives, or maybe leaving comments after and so on, asking different questions, because every child and every particular situation is different. Now, I hope you're having a good summer. I hope all of you are okay. I hope that in case if you have an occupational therapist by your side, you are satisfied. If you are watching, you would like to become an occupational therapist, this is an amazing profession. If you are a parent who is looking for an occupational therapist, make sure that you choose a good occupational therapist, an occupational therapist who understands what are the needs, what has to be done or not, what not. Occupational therapy is very it's a huge profession covering different skills and milestones, and structures. But in any case, our therapy is always in individualized way. So I cannot apply what I know for every single kid. And feeding, it's like one of the secrets that I've been in this profession for many years now. I'm always not like discovering, like I will say, like, I know everything about feeding, and then I will meet a child and I'm like, oh, okay. So here it's different. And it's totally normal, because every child has different background, different pathology, different condition, or maybe skill development, milestones, environment, school setup, home setup, etc. And in feeding, it's very important to understand, this is why the reason I'm telling you there is no a particular therapy or a particular way to work on feeding, on oral motor skills, because every child needs that individualized approach, that individualized therapy. What I like to do is in my first visit, my first consultation, to make sure that what the child eats, what not, how the child eats, and what are the main struggles in oral motor skills. And then from there, from there we know exactly what the child is struggling, how we need to help, and what's going on, how exactly we are going to teach him or her to cope with this. Now, what is happening actually? What is happening actually with the feeding? Sometimes you will have children who starts to eat many varieties of food and then stops. That's case number one. Then you will have children who never were like a super fan of eating, and they will be already like very picky about food, and eventually they even decrease that amount of food. And then you will have children who will be like eating everything, okay, and at some point they are going to be very picky about a particular textures, but they will not refuse completely the food. So you have, like, I will say, like these three cases, even though sometimes you might have more. If the child is eating everything and suddenly we are showing particular difficulty on particular textures, then we can be working on that particular texture and that particular taste or color or food or whatever. If the child, and that's quite easy case, I will say, besides implementing some structure and some oral motor activities, most of the time it's an easy way to go forward. You will have children who are very good with purées, and liquidized food, and then they will be struggling with actually the bigger texture, crunchy food, pieces, when actually you have to chew. That's also a case of children that can be easily faster to improve, because we need to just understand what is the difficulty. But what is the case that always surprised me a lot is the case where the child is eating up to an age of 2.5, and then suddenly, and he will be or she will be eating everything, like all the soups, purees, crunchy food, smashy food, whatever, and then at a particular age they literally stop and they go like backwards 10-20 times, and instead of eating, for example, 30 items, they start eating 5, and every year progressively they will be decreasing this amount of intake. And this is where I actually say, like, these type of cases are always surprising me, because even though I think, like, I already saw and worked with many children, it's always surprising me the psychology behind the identifying the actual issue. For all these cases that I've been mentioning before, we have to make sure a couple of things before to start with feeding. Okay, always make sure that the child know how to blow, how to whistle, how to drink from a straw, how to manipulate different type of whistles, balloon, or for example blow the candle, in the system of blowing. And if the child knows how to chew or not, because many times I will have parents like, no, but he was chewing, he chews, he eats crunchy food. But when it comes to this particular pasta, he doesn't eat it. I still check the chewing, because many times what you consider parents that is chewing, or even therapists, it's not chewing. And because the child is not chewing properly, or because the jaw is not formulated properly, we're having a big step back and we're having a big issue with chewing. So I brought with me, this is not the first time that I'm doing this speech, but I am just, I always cover it from different angles, because like I said before, doesn't matter how many times you can talk about a topic, there is so much to discuss. And there are so many different types and issues and difficulties, that it's always maybe like this particular topic or this particular technique can help you. Okay, I brought with me different chewy tubes, and I'm going just to show you that the reason why it's super important that we know that the child chews properly. In order for us to chew properly, that means that I put the food inside of the mouth, the food goes on the side, pass through the middle and goes to the other side. You chew, pass through the middle, you might repeat or you swallow. Now this is most of the time the functional, complete activity of chewing. Nowadays, you will have a lot of children who, because of the sensitivity and maybe because of the awareness or maybe, how to tell you, difficulty in experimenting with the food, will just put the food and try as fast as possible, like, swallow it, gag, and vomit. Or you will have children who will place it on the paladar, on the top, on the palate, and will stay there. Or put it behind on the cheeks, or put it behind the teeth, and the kid will be with the food there, basically stuck. So doesn't matter how much your child knows how to chew. When the food appears in the mouth and it's not food that he likes or she likes, or it's food that it's complicated, the nerve system blocks. And actually he doesn't or she doesn't know what exactly to do. This is the reason why I will be always suggesting chewy tubes. Now, we work with something called the Z-Vibe, and I already did a video about it. I don't want to repeat myself very much, but this is the Z-Vibe. It's a small thing that has batteries inside, and you have different attachments. For example, if you put the blue attachment, it will help you, basically you chew like this, it will help you to chew on the side with the vibration. You don't have to always go for this, but these are actually good. You have, for example, different spoons, that you can also attach to the Z-Vibe. You have different like brushes and tips that depends on what is your need. You can use them differently. But what I like a lot is actually experimenting just with the chewing in the mouth and the vibration. For example, if your child is extremely picky, imagine you never tried any pieces to give him, and you're scared, because that's totally normal, parents. I know you're scared, and this is the reason why you should go for a therapist. I like to use, for example, this one. It looks like a teddy bear, super cute. And use it for just massage a little bit on the face, okay? And then slowly go around the lips till you enter inside of the mouth with vibration or without. It doesn't matter. So sometimes it's not about the going straight away with the food. It's actually building up, tolerating, experimenting all the sensory areas around the mouth before actually you will go with the food. So I will be using skills like that. This is from Arc Therapeutics. I'm just going to share with you their voucher over here. Arc's Z-Vibe, arctherapeutics.com. They are extremely good. They have a lot of cool stuff, and you can always buy them online and try them at home. On their website and on my YouTube channel, you have videos about how to use it, some of the tips. So please go, check them, follow them. They send a lot of different videos, how to use them, etc. So they are extremely good. Then, if we don't use something like this that requires vibration, we're going to be using chewy tubes, normal chewy tubes. For example, I have different chewy tubes like this. This one is very popular. It has different textures, which is great because many times children who will be struggling with chewing skills requires a little bit more of something nice and different in texture. So you can be using this. For example, I will be having something like this, which is very soft. Okay, I will be having, depends on the age, maybe a chewy tube that has like a little handle so they can grasp it and hold it. So these chewy tubes, you can use them at any time, whenever you want, however, how much time you want per day, as soon as the child is chewing properly on them. So the child doesn't put them basically in the mouth and just stays there for hours. No, the child needs to place it in the mouth and activate the chewing, the active chewing. Once we have the active chewing, we can actually say, okay, the child knows how to chew. Okay, it's not like the child is just playing with the chewy tube. And you will be surprised that even sometimes when we have the active chewing, the child still struggles with chewing, because sometimes it's not about the chewing and it's about the food, and sometimes it's because of the food and the chewing. So as you can see, we are never bored. We are always learning and we are always experimenting, no? For example, something that I find useful as well, it's like I have different type of chewable sticks, and they have like a number, and it will go from like 1 to 6 or 7 or 8, depends how many you buy. And for example, you can start with number 1 and then progressively go to number 2, number 3, number 4, etc. The idea is that obviously more we increase the number, okay, this is very rigid, more the child needs to exercise on the chewing, because it's more thicker, more difficult. But you have children who are grinding their teeth and who are constantly seeking for chewing purposes, no, for chewing activities. So this is, for example, something that is super interesting to work on. Sometimes, like I'm saying, I will be spending the first sessions just checking all of this, working on the chewing, gradually preparing the child to get better at chewing, and then slowly go forward with the feeding. Like I was saying before, independently how many chewy tubes you have at home, there is no one particular chewy tube that is better than the other. They are all great. It doesn't matter if it's a brand or not. The most important is the use. The question that I always receive, it's from parents, it's how many times per day I have to use the chewy tube. Well, like I said before, you can use it as if you want to use it every hour. It doesn't matter. There is no a rule for you to say I need to use it once in a week or twice in a day. It all depends on your child's need. If your child grinds the teeth, is constantly grinding teeth, pressuring, is constantly seeking in chewing other things than food, you need to implement more. The more you practice, the better. In any case, it's extremely healthy and extremely beneficial. It's not something that is going to be never against your teeth, or like, oh my goodness, you're going to create a bad behavior or bad pattern. But if your child struggles only during the feeding, otherwise his chewing skills are okay, I will only use it for activity purposes. That means that if it's only during feeding, we only use it during feeding. So this is very individual. It depends on the child. Sorry, I have to make a break. So that's about chewing. Now, when we introduce feeding, and when we introduce how to introduce feeding, once we make sure that we have the chewing skills, we are going to go for food that if the child was eating before and now stopped radically and we are decreasing in food, we are going to go for food that the child used to tolerate before. You will say, but he stopped or she stopped eating them, so why do you want to come back? The nervous system is very simple. Once we add and we tolerated something, most probably the child will come back to it. Okay, the only thing we have to understand if the difficulty was on the food or because the child the child's skills improved, matured, and suddenly his nervous system started being occupied by sensory needs, speech difficulties, or other stuff. Because we have to understand that most of the time we don't have only a child with feeding issues, We have a child with feeding issues. We have a child with attention difficulties. We have a child with regulation. We have a child with fine motor skills difficulties. We have a child with potty training issues. So we have a bunch of different systems that are not settled, and we are trying from different angles to satisfy and to ask the kid, hey, come on, let's work on this, let's work on that, let's work on this. And it's not possible, okay? So sometimes the child, the nerve system start dividing the energy. And sometimes the child understands that I don't need anymore the amount of food that I was having before. So we start reducing and we start being very rigid about the food that he used to intake. So we have to be extremely careful about this. We have to be very good at remembering what the kids eat or used to eat. And this is what I always suggest. Start with the food that he used to tolerate or she used to tolerate. And then slowly increase the texture. In case if you find that this is something difficult, because not every parent find it comfortable to work at home, who can take care of this? An occupational therapist, a speech and language pathologist, and I guess that any therapist specializes in oral motor skills or feeding, but most of the time we are in these two professions. Sometimes you have ABA targeting feeding, however, maybe with different techniques. So you have to see, depends where your child is attending, depends what your child's needs are a priority. You can prioritize exactly what would you like to focus. It's not meaning that if you want to focus on feeding, you cannot focus on behavior or you cannot focus on communication. No, actually you can focus on everything. But just make sure that when you're working on feeding, the person who works with you and with your kid understand exactly and satisfy your questions. Let's put it that way. Because sometimes I have parents who will be very confused about all the system, about the feeding, how does it work, etc. And not all the therapists are able there to answer certain questions because of their experience, because of whatever, you know. So, and sometimes because the child one day display one behavior, another day another behavior. So you need to have very good observational skills in order to understand what is the reason why your child is having this particular difficulty with feeding. So I always suggest the same, you know, like try to understand first what is the difficulty, what the child was doing before and how he or she is acting now, and understand like what is the key, what is the difficulty, and then work on that difficulty. But don't try to just like start experimenting with the food randomly, like let's try yogurt, let's start like some biscuits, let's start some, I don't know, puree. The food, it's very important. When we present the food, we don't present the food because we want the child to eat. And this is very important. We don't want the child to eat. We want the child to actually do the exercise, which is eating. So we are not waiting for a gourmet menu, or we are not waiting for the child to be extremely satisfied how we cook or how the plate is presented. What we want is that the child understand that now we sit, we're going to work on Chewy Tube, imagine, or we are going to work on oral motor skills, and we are going to present an apple or a banana or pasta, and this is part of the activity. In the meantime, the child is eating, of course, but your idea, it's not like, let's see how good it is, how tasty it is, look, I cooked for you, etc. Even though sometimes I use those sentences, the idea, it's not for you, for the child to enjoy the food. The idea is the child to do the activity of eating, which is very different, okay? Because many parents have like this big expectation that we are going to make a sandwich and the child will just love it from the beginning and he will eat sandwich for the rest of the life. But unfortunately, the child doesn't eat the sandwich, not because he doesn't like the sandwich. It's because maybe there are certain structure inside of the mouth or the brain that doesn't let him enjoy that sandwich, okay? And tolerate it even. to the point even vomiting because there is the sandwich inside of the mouth, you know? So it's not about the texture, it's not about the color, it's not about the smell, it's not about anything of that. It's just like there is no enough skills build up in order for your child to tolerate that sandwich. Okay, so this is a very hard job for parents. I am super proud of all my mamas. If some of you are watching it, watching these videos or not, or watched after or before, I am super extremely proud of my mamas who are working in feeding at home, who are following not just my recommendations, but in general, like all the recommendations about feeding, because it's extremely difficult activity. Just don't lose the hope and continue working. Doesn't matter, it's not easy, doesn't matter how long it will take, there is always a way to find a solution for the feeding, always. The only thing, it's not always cute and nice, and it doesn't take 1 or 2 days. Most of the time it takes a couple of sessions, you know, a couple of weeks or months in order to settle down your kid and actually make him eat, okay? So with this nice message, I'm going to say goodbye to you for today. It was a nice short session. I think I provide you a lot of information, a little bit of my point of view as professional. That is a little bit the aim. I am super thankful for your support. Please make sure to subscribe, to follow me on my social media. And if you have any questions, if you would like to share some of your stories, please feel free. I am here for that. Every Wednesday, I connect around 7:30 Europe time to talk with you, to share some of my knowledge and experience, and basically, to provide a little bit more of information about occupational therapy or any other topic that we are discussing. But I know that feeding is very important. And feeding is very important, oral motor skills is very important. This is one of my main roles, is to continue providing this this awareness to you, okay? So take care. I will be seeing you next Wednesday, and thank you very much for watching. Bye bye.